All right, good afternoon, everyone. Thanks for joining our HealthLinks webinar series today. As many of you know, HealthLinks is a signature program of the Center for Health, Work, and Environment, and we are here at the Colorado School of Public Health. And our mission is to work with employers to improve the lives of their employees to be healthier and safer. I'm Kayla Rivera. I am the Community Engagement and Trainings Manager, and I'm excited to be doing this webinar series and bringing to you the latest and greatest information to help support your workplace efforts around health and safety. So as you can see here, we have our HealthLinks benchmarks, which comprise the HealthLinks standard, and we try to relate our benchmarks to one of these standards just to provide the resources and content back to you to help you improve in the areas that we know create sustainable workplace health and safety. And today we have Dr. Lee Newman, who is going to be talking about cancer supportive workplaces, which fits within our health policies and programs benchmark, as well as organizational support and engagement. And before I introduce him fully, I just want to go over a few general housekeeping items. Everybody is kept on mute throughout the duration of the presentation, and it is being recorded so that we can post it onto our YouTube page and share this out with others afterwards. But if you do have a question, you can always use the chat box in the control panel on your screen. It's up at the top, or perhaps you've moved it down to the bottom because it is movable. But you can simply type that in and we'll be monitoring and we'll answer your question once we see those come through. And as I mentioned, it's going to be recorded, and we will be sending out a copy of the slides and the link to where you can find the video to share with your colleagues and to review again if you would like. And right after this, I'll be sending out a short email to you. We've changed up our evaluation side, and I have a brand new one-question survey if each of you would take the time to answer for us, just so we can gain some feedback on these webinars and really just bring to you what you're looking for. So enough of me. I will go ahead and introduce my colleague and the director of the Center for Health, Work, and Environment, Dr. Lee Newman. He is a researcher, physician, public health practitioner, and educator. He's a professor in the Departments of Environmental and Occupational Health and Epidemiology at the Colorado School of Public Health. He's our founding director of both the Center for Health, Work, and Environment and the Mountain and Plains Education and Research Center. He co-founded HealthLinks and the Colorado School of Public Health Certificate in Total Worker Health. He is also a professor of medicine in the Division of Pulmonary Sciences and Critical Care Medicine at the University of Colorado Anschutz Medical Campus. Dr. Newman consults for government agencies, multinational corporations, small and medium-sized enterprises, labor groups, and community organizations. And his favorite role in life is as a mentor, which I can attest to, but it's second only to husband and father. And he is irrationally optimistic, which is also very true.
Well, thank you very much, Kaylee. It's fun to be here on the webinar with folks today. Let me make sure I've got the forward button going here. Get off of my face, and let's go on to the topic. So, and this is a challenging topic. Because any of you who are listening to this right now, and I personally have had experience with family members, friends, coworkers, colleagues who have experienced issues around cancer, who have been cancer survivors. This topic was really brought home for me by some of my colleagues, as well as reflecting on some of my own past experiences. And I want to start off by acknowledging and thanking especially Kathy Bradley, who is a professor in the Department of Health Systems Management and Policy and Deputy Director of the Colorado Cancer Center, for really connecting with our center here, the Center for Health, Work, and Environment, to start understanding how to improve the situation for cancer survivors in the workplace, which will be our topic today. I also want to acknowledge and thank the other people whose names you see on the screen here, who have really contributed a lot to my thinking around this topic, have been research collaborators of mine on this topic, And in fact, everybody that's listed up there, including the partners from the School of Medicine here at the University of Colorado and from Kaiser as well, we have an editorial that is coming out very soon in the Journal of the National Cancer Institute on this topic. I also want to acknowledge cancer survivors who have shared their workplace challenges with us and participating employers who you'll hear more about, that we've engaged to understand some of their concerns and some of the uncertainties for employers around what to do when employees, coworkers, or they develop cancer. The photo here is of someone named Pixie Campbell, who was one of my mentors in my life. She was my boss when I was learning how to become a scientist. And Pixie was a cancer survivor. She had cancer twice during the time that I knew her. She died in her 50s prematurely of cancer and had to keep her job even as she was going through cancer treatment. So she was a PhD scientist, a very distinguished scientist at in a healthcare system doing research, and struggled to keep her job going until very close to her death. For many of the reasons that other people keep their jobs going as they go through cancer treatment. In her case, it was because she needed the healthcare benefits, as well as we know that there are other reasons why people continue to want to be productive in their lives, even as they're fighting with cancer. As an overview, we're going to touch on cancer survivors in the workplace and the changing landscape. We're going to talk a little bit about the employee perspective, the employer perspective, and I'm going to give you some resources and suggestions on where there are opportunities for us to improve our approach to cancer survivorship in the workplace. So let me define terms first of all. So what do we mean when I refer to it as someone as a cancer survivor? This is from the National Cancer Institute. Their definition is one who remains alive and continues to function during and after overcoming a serious hardship or life-threatening disease. In cancer, a person is considered to be a survivor from the time of diagnosis until the end of life. So if you ever had cancer, then you are considered to be a cancer survivor. Whether you are cured or if you continue to live under the shadow of potential recurrence, or to the time where the cancer might kill you. So that's the National Cancer Institute's definition, and I'll be using that throughout today. So a few statistics. There are 15 million survivors, cancer survivors in the U.S., and it's growing because we have successful new treatments. And I'll show you a little bit of the data on the trends. It's really great news for us that we are having so many people surviving as we have new treatments. There are 1.7 million people in the U.S. diagnosed with cancer annually. So, cancer continues to be a serious problem for us. And in terms of why talk about in the context of work, well, about half of the people who are diagnosed with cancer are working age. If we want to define it as 20 to 64, and actually beyond, because we also know that the employment rate for ages 65 and older is now 19%. So the 65 and older group, nearly 1 in 5 are continuing to work. So there's an increased likelihood that cancer diagnosis will occur while people are in the workforce. 60% of cancer survivors are working in the U.S. today, more than half of which are women. So there's reason to put this in the work context, because in sort of the big picture, what are our employers trying to do? What are we as employers trying to do? And that's to meet some kind of a mission, and leadership has a big role to play in that. We in our enterprises, in our occupational settings, need to have a productive workforce to achieve that. We need an organizational culture for that productive workforce to be successful. So leadership has a big role in this. And one of the things that we drive home as we work with employers is for people to understand that to do that, you need to create favorable work conditions, which often implies work around benefits, for example. We need to be doing things that promote health and safety. So in the big picture, if we think about people who are cancer survivors as part of that workforce that needs to be productive to help us meet the mission, given the statistics I just gave you, we need to be paying attention to how do we meet the needs of cancer survivors in the workplace. Just some statistics for you in terms of new cancer diagnoses in 2018. For those of you who are watching this in Colorado, you can see that what's anticipated for this year is that we'll be looking at a little over 25,000, well, almost 26,000 new diagnosed cancer cases, and that's excluding people who have most forms of skin cancer. So, this is obviously a significant ongoing issue. Is how do we ensure that people, when they're diagnosed with cancer and thereafter, can continue to feel good about being productive members of our workforce. Just a few statistics for you. These are the trends in terms of cancer death rates by type of cancer. This is for women, showing a trend from 1930 to 2015, which is where we have still our best data. This is from the American Cancer Society Surveillance Research Group. I think what's important to point out here is that for most forms of cancer, to my earlier point, we're winning against cancer. We still have millions of people getting cancer every year, but we're more successful in having people live longer with it. So the death rates are going down, even for things like lung and bronchus, and in women, breast cancer rates, colon and rectal cancer, pancreatic cancer, and liver cancer are going up slightly. But for the major forms of cancer that cause the most fatalities, we're seeing improvements. These are the rates of fatality per 100,000 women in the U.S. population. Among men, and this is on the same scale, so you can see there have been a lot more fatalities because there have been many more cases of lung cancer in men, but in men as well, and for prostate as well, colon and rectal, we're seeing improvements and that's leading to more people going through treatment while they continue to work and surviving longer from these conditions. In terms of the workplace, there's a cost to this, and the cost, I always cringe when I put these things into dollar figures, because the cost, and we're going to talk more about it, it's a human cost. It's not just about productivity. But if we're going to talk about it in the context of the workplace, the net productivity loss for people who have cancer related to them being out of the workplace, either because they couldn't maintain their job or they had to cut back and use more of their time off, the estimates run between $10 to $16 billion annually in terms of net productivity loss due to cancer for people in the workplace.
Could I ask a question there?
Sure.
Is that cost to the workplace the estimate, and does it consider, even the individual? What if they don't have PTO? What, the cost around them not being able to work?
Yeah, those statistics are really just looking at, what is it costing American society? Mm-hmm. But the cost to us each individually, and we're going to come back to this a little bit, Kaylee, later on. It's a great question because the consequences for an individual when they can't be at work. They may lose their job. They may be part-time or already underemployed. They may be a contract worker where they only get paid if they are working. Not to mention all the other consequences that you may lose the contact that you have with your coworkers. Your sense of identity is very often wrapped up in the work that you do. Your sense of meaning and purpose can be tied to your work. So the costs here in terms of the implications are go much deeper than just some statistic.
Yeah, great, thank you.
The fact of the matter is that most people, from the time that they're diagnosed with cancer, want to keep working following diagnosis. work is, and gosh, you gave me a perfect segue to this slide, didn't you? It provides a sense of identity, a sense of normalcy. My mom, when she was going through treatments for cancer, kept working, the whole time, even though she'd be in the hospital getting chemotherapy and radiation. She continued to work because it gave her that, she defined herself through her work, and gave her a purpose. It also gave her distraction. Having the support of your coworkers as you go through treatment is also important. And sometimes you have those relationships outside of the workplace as well. We all understand that. You have friends that are coworkers of yours, but it's we get a lot of support in the workplace. The financial burden associated with high-cost therapy is another big deal in terms of why people want to keep working. But cancer treatment, on the flip side, can be a major barrier to people's ability to return to work and stay at work. Our workability, our job performance, job satisfaction are all things that can be compromised as we go through cancer treatment and thereafter. There are some significant trends going on also in terms of cancer diagnosis and treatment that are affecting employment. And one of them is this emerging area around how we treat cancer with oral agents. Agents that can be taken as outpatient, that somebody could even be returning to work and continuing on treatment. So that's been evolving from where we've had people used to be hospitalized to get their infusion therapy, then we moved to outpatient. In the last 5 years, there have been 15 oral agents approved for breast cancer, lung, and colorectal cancer. So patients are now making somewhat optimistic assumptions that if they can take these medications at home, that maybe it won't interfere with their work. And employed patients may start preferentially selecting those treatments because they view that it won't interrupt the work that they do. The flip side, unfortunately, is that these medicines still have side effects, and they can predispose to the kinds of things that we know from cancer chemotherapy. And I think one of the things we don't really understand yet is, but I would suspect, is that employers as well as employees may assume that if someone's taking oral medications for their cancer, that they continue working just like they were before without having to take time off or have side effects that might disrupt work, and that's probably not true. Yeah. So these are some of the trends that we're seeing around the workplace. I think that you and I kind of queued up this question for this next part.
Yeah, and take a moment to read it as well. If you did want to chat in, we're happy to add you to the discussion. But Lee and I will kind of talk through this. When I read, what are the challenges or concerns for employees? I mean, the list could be endless. But thinking of your last slide, that's such an interesting concept. Really thinking of, oh, I'm just taking this pill for the day. That's my therapy. I should be okay. And if your employer doesn't fully understand that, and you don't understand the risks, if you're operating machinery or something, I'm just thinking of all the other challenges that could really present, and risks for an injury or anything really.
Well, there are physical demands of work, and there are cognitive demands of work as well. Mm-hmm. And I do want to come back to this a little bit more, because depending upon the kind of job you do, it's the same issue, frankly, that we have for anyone who has a health condition that may impact their ability to do their job. We have to be mindful of the fact that depending on what kind of work you do, the medicines you're taking, the diseases that you're fighting, that whether it's a chronic illness, it's cancer, it's even an acute illness, could impact your ability to perform your normal job the way that you normally would do it. I was just giving a lecture 2 weeks ago at a conference in Arizona, and in presenting this, it was, first of all, it was very emotional, because it was a room of 250 people, and it was in a ballroom that shrunk to the size of a closet in a matter of minutes, because people started talking about what they were experiencing in the workplace around the things that made it challenging for them. And part of it was that there were people saying, I want to still do a good job, but my treatment got in the way. of me being able to perform at the level that I wanted to perform. So it's this is a complex and serious issue. The fact is, even though 3/4 of people who are diagnosed with cancer want to keep working, about 13% of cancer survivors quit work within 4 years of diagnosis. So there are things that are definitely keeping them from being able to stay in the workplace. And some of the things that are contributing to the poor work outcomes include poor symptom control, having treatments that affect these physical or mental abilities, and like I mentioned, some of the emerging use of the oral agents can be affecting people as well.
Yeah, if you don't mind, I wanted to touch briefly on the comment that was put in there. Lily, thank you for sharing. I think that's a great point, is that survivors, depending on where they're living, if you're in a rural area and you have to travel to Denver, or if, located in another state to try to seek the treatment, that's another big barrier and challenge that an employee could be facing.
Access to care, especially specialized treatment, is a problem for many segments of American society. People who live in rural areas, people who may or may not be fully insured. There are a lot of barriers, and so thank you for that comment. All those factors, those larger societal factors that are barriers to cancer treatment and care, including insurance and where you live, are just compounded when you think about it in the context of also trying to keep your job going.
Yeah.
So in the first year after diagnosis, the average cancer patient will miss about 17, on average, will miss 17 days of work. Whereas, the rest of us, the average would be about 4 days of work due to illness.
Yeah.
So, and in the year after the first year of diagnosis, people will miss, due to cancer, will miss about 9 days a year due to cancer. So now add to that travel to and from visiting doctors who may be, even if you're rural, a couple of 100 miles away.
Yeah.
Is a significant issue.
Definitely.
Let me, let's see if I still got the arrow going the right way here. How do I move the arrow there? So give me a second.
I did.
Oh, there we go. Oh, good. So, so this just puts it in this broader context then. So if you think about our life outside of work and in the workplace, we always have the issues around workplace safety and workplace injury, but then we have the employee's health, of which having a cancer diagnosis is a part. We have to think about how the injuries we have, as well as the illnesses we have, interact with the job demands, our physical and cognitive demands, and how they impact our productivity, resulting in being absent from work, or maybe coming to work but not being able to perform at our highest and best level, which is referred to as presenteeism. So these are some of the factors that go into the equation. If it's a physical job, if you're going through, if you just had a major surgical procedure to cut out a cancer, can you be lifting, carrying, walking? And what kinds of accommodation do you need? If you have a cognitive job, there are stories of people who work as trial lawyers who will delay receiving chemotherapy because they're worried that it'll impact their ability to handle the cases that they have to handle in court, because it's affecting their concentration, their memory, the precision of their thinking. So turning to the issue of what do cancer survivors need from their employers, turns out there's not been as much research done on what employee survivors need as you might expect. And we've been writing some research grant proposals and doing some pilot research in partnership with the Colorado Cancer Center to understand this better. But at least one study that was done looked at what cancer survivors require in terms of accommodations. And we'll talk more about this in a few minutes. But the kinds of things I just want to get people's juices flowing in terms of thinking about what can happen in the workplace that might be more accommodating things like graduated return to work plans, having modified work duties and performance expectation, in some cases retraining to do other jobs. Sometimes it's modifications to the physical workspace so that people can continue to come to work even while they're on treatment. Adaptive aids is another category. So there's been a little bit of research starting to understand what the needs of patients are. And some of the perspectives that we're receiving in terms of cancer survivors from the employee and employer can be lumped into really 5 areas. There's the area of understanding what kinds of accommodations are needed, what's needed in the benefits packages, the type of employment that somebody has, how good the communication is between the manager, the HR department, if there is one, and the cancer survivor is a whole nother issue, as well as just having the kind of culture that you need to support somebody through this.
Definitely. I know you're going to get into each one of those a little bit more, but the bottom 2, I just wanted to kind of share anecdotal information. I've done a couple interviews with our folks in our network, and one story, about a gentleman, Brian, finding out he had cancer through their wellness screenings and things. What he touched on the most was the fact of good communication with his boss, and that they always checked in and were supportive in all those ways, and how that made a huge difference, because he didn't have to remember himself like, oh, I need to call my boss and give them an update, or I didn't tell HR this and I forgot that. There was very streamlined communication around that. And then just the culture piece of social support was another thing that he mentioned was huge for him.
Yeah, no, those are great examples, and those are points that resonate the people that I've talked to. And again, I'll refer to this group because I'm still emotionally affected by giving this talk to a group of 250 people and just the outpouring around this. Those are exactly the kinds of things that came up, and yet there's a lot of uncertainty. There's a lot of discomfort that we have around, well, what should I communicate? Will it be used in some punitive way? There's a lot of issues around trust, and that's where the culture and communication piece are working either together for good, you hope for good. Let's talk about some of these 5 areas. So in terms of accommodations, what does that usually mean? It usually implies the need for things like more flex time, rest breaks, where possible, working from home. And let's sort of stop for a second, just think there are a lot of jobs where you have to physically be on a clock. That may not be something that can be accommodated. There may not be the option to work from home if you have certain types of jobs. This group I was with, many more healthcare workers. Their job, if you're a nurse working in a hospital, you basically, there aren't that many options. You need to be at work on a shift, and you need to be able to perform, and you can't perform it from home. But I put in here just a few of the quotes that have come from patients that have been part of support groups that have worked with our colleagues at Kaiser, and also things that you can find on the internet from cancer survivors on their websites. And I don't have time today to go through all of these, but for people, I would love to have you take the time to read some of these quotes and think about the implications of them. And I'll pull out a few of them as examples. So the one on the right, the very idea of, this is a cancer survivor speaking, the very idea of asking to be accommodated. If you were to say that there could be an issue of you doing the job, the employer could say, okay, we're going to ask you to step down from this temporary position right now and have somebody else do it. That's the kind of concern that cancer survivors might have. Here's another one. I found I was getting more and more fatigued, so I went to personnel and asked them if I could go part-time, and they were very sympathetic and said they would talk to my boss about it, who was fine about it. Right, so you can have very different kinds of potential reactions, and this is one of the things that cancer survivors often don't find out about until they're in the situation. So accommodations is one area. Benefits is another. Does the company offer health insurance? Is there paid sick leave? How does it handle the Family Medical Leave Act, FMLA? what do you have in terms of short-term disability? And the benefits area around this is a huge factor. And as we know, a lot of employees really don't even know what their benefits are. And often managers don't even really totally understand what they are. Just in the interest of time, I'm not going to read you these quotes, but the understanding benefits related to cancer survivorship turns out to be a really big part of accommodating the needs, in addition to adjusting the job. Just most fundamentally, is there healthcare insurance, and is there support of disability, at least short term?
Absolutely. I find that in general, when doing advising with organizations, benefits are this weird thing that people aren't always clear on. I mean, I myself have to take time to review them and really get a thorough understanding, because for some reason it's like, oh, I don't know what my benefits are and how to utilize them. And there's not, an easy digestible one-pager that I've found yet. But I think that's important for employers to be really transparent about that, and offer those times that people can come in and seek out what are the benefits, and make it clear as much as possible.
Yeah, no, I completely agree. Let's talk about this. We've touched on it lightly already. The type of employment arrangements that you have with your employer matter. So, Kaylee, you're a full-time employee of the University of Colorado. It's a pretty clear benefits package if you could decode it. Yeah. but what if you were part-time? What if you were on contract? What if you were, in a service sector where, like I use that example of the nurse who's got to be on the job. Here are some examples. On the left, there's a quote. I'm a 1099 contractor, so I've had to carry my own health insurance, and this doesn't hurt any type of work I encounter. Why would any of these employers care as long as I do my job that they've contracted me to do, right? And basically what this person's trying to say is, you know what, I can take care of the health benefits I'm paying into an insurance plan, but if I'm not working, I don't have any income, and I lose the contract. Here's another one. I'm self-employed, and I have just been through a year of on-off working while dealing with cancer. I tried to claim some benefits the first time in 40 odd years of working life, but there was always some clause that made me ineligible. I had to drag myself to work on many days when I was feeling really ill and tired from the disease and the treatment side effects to keep rent and bills paid. It seems that us self-employed people really get a rough deal.
That's a unique one to me. Because I'm not self-employed, it doesn't always cross my mind, but that's a really interesting concept. And same with, we're seeing more and more jobs in the gig economy. So how does that affect them? And, what does that look like? Similar to the quote on the left, if I'm not working, I'm not making money. So that's going to be definitely a big challenge.
Yeah, you think about the Lyft and Uber and TaskRabbit and, all the other folks who are out in the gig economy. There's some new statistics out. I think we have about 5 million people now in this country who we'd call gig economy workers, and I'm not going to get into the details of what the potential issues are around their benefits and their health care. But the bottom line is, if they can't drive, they're not making money. Let's talk about the communication challenges, because this comes up a lot. And when you look at the various blogs and you talk to cancer survivors, and you mentioned it already, Kaylee, there's a lot of discomfort around, do I disclose the diagnosis? And on the employer side, how do I approach an employee? If I have someone working with me where they're showing signs of extreme fatigue, they're missing work, they seem to be having either physical or cognitive problems on the job. As a manager, what do I say? What can I say? There's a lot of uncertainty that people have, and people are worried about, do I cross the line if I ask too much? And yet on the patient side, on the worker side, they're going like, I want someone to know, I want the support. Do I share it?
Yeah. And I'm excited to see in the future how the research expands and just the more knowledge we can gain around this, because I'm very curious to know people from different backgrounds and different cultures, how do they interact and communicate around these types of challenges with their employer, because we know that it might be more uncomfortable, or just the differences that we may see in the trends. I think that'd be helpful for employers to get more information around the cultural competency piece of it all.
Yeah, I agree with you there. I'm gonna pick up this quote on the right, because I think this is really reflective of a lot of what's happening in the workplace from the manager side. So I was told that I wasn't really allowed to ask very much. You want to be sympathetic and give them leeway, referring to a cancer survivor, give them leeway and time to get better. But if you can't ask them anything, it's very difficult to manage, right? And I've heard that a lot from people on that side of the equation. So communication challenges. And communication is a lead-in to, this and the accommodations point are a lead-in to what may be one of the most important slides that I've got here to share with you today. What are the biggest predictors from the research? What are the biggest predictors of return to work for cancer survivors? And they fall into basically these three areas. Stigma, a perception that I'm stigmatized because I have cancer. Discrimination, a perception that my job is discriminated against me because I have this chronic illness and I have this cancer and I have these healthcare needs and these insurance needs. And then the availability of accommodations, which we've talked about. These three are the biggest predictors of return to work. So if you think about all of those cancer survivors who are still in the workplace, what do we need to do to help them stay on the job? We as employers and as coworkers need to be addressing stigma, discrimination, and the accommodations. 44% of Americans report that their organizations support employee well-being. Now, I've seen lots of statistics around this, higher and lower, but the general ballpark is that somewhere on the order of a third, or a little bit more, of workers actually think that they have a supportive workplace for well-being. But here are a couple of key points. Survivors who felt discriminated against or who had unaccommodating employers are the most likely people to not return to work after they've gotten treatment. And in a study of low-income, multi-ethnic women with breast cancer in particular, found that those who are working for accommodating employers were twice as likely to stay on the job. It makes sense.
Yeah.
But people, need to understand that if you want people to be able to stay on the job, you need to be helping to combat the stigma and also address the accommodations. And our research is showing that employers have a lot to learn. So employers, in our experience talking with employers, they often lack the understanding of how to create workplaces that provide accommodations for cancer survivors. Kaylee, that I did a business startup about 10 years ago. It's a successful business now, but while I was running that as the CEO, we had people who developed cancer, employees, coworkers in a small business who developed cancer, and the impact emotionally, apart from their productivity, just emotionally, the impact on a small business was huge, and we did everything that we could to accommodate the needs of those people in the workplace. But it took a lot of thought and a lot of discussion to figure out what we could do, what we couldn't do, and what was allowable under the law, et cetera.
Sounds like it comes back somewhat to that culture piece, because you were being open, you had the communication, you were trying to be accommodating, and those to me speak really to that culture. Like, let's all talk about this and find the best solution.
Yeah, and it still though makes people nervous, and it should, because there's a potential for discrimination, or if somebody really can't do the job and we can accommodate them and they can't keep working for us, are we going to get, are we going to have somebody come back and say, well, you discriminated, and next thing you know, there's a lawsuit. So we're in a fairly litigious society, and so it's challenging. I do want to point people to a resource. The Equal Employment Opportunities Commission actually has it's a couple of pages of case studies that help discuss the.
I apologize. I was informed it was in presenter mode, so I just wanted to give a full view to everyone of the slides.
Okay, great. All right. Well, now you got the full picture. But you know, the Equal Employment Opportunities Commission has a really excellent set of questions and answers about cancer in the workplace and around the Americans with Disability Act. So this is a great resource for you. It's only a couple of pages long. Of course, it's in, you know, like, it's not very attractive to look at because it's a government website, but it has great case studies. And so I want to refer people to that if they're wondering, like, what are the limits? And they do an excellent job with it. I'm not going to spend a lot of time on it, but there are protections that are on the book. So there is the Americans with Disabilities Act. There's FMLA, which protects unpaid leave for up to 12 weeks. So your job is still there, you know, for at least that period of time. But note, it doesn't apply to employers with 25 or fewer employees unless the employer decides that they are going to comply with FMLA. There's also COBRA, which allows purchase of employer-based health insurance for 18 months if someone is terminated, but you have to pay for the full coverage. There's the Affordable Care Act, and for now, some low-wage workers qualify for expanded Medicaid and health insurance exchange marketplace access. So, there are some, if you will, protections in our society that are on the books for cancer survivors in the workplace. It varies by state, but there are fair employment laws. There's also for federal employees, the Federal Rehabilitation Act. It's a maze of protections that are on the books, and yet when it comes down to it, what happens to you in the workplace requires research, and at a time when you probably want to spend not more time, but less time focusing on that and more on surviving cancer. And unfortunately, there are gaps in these legal protections. I just want to call out that about 58 million workers in this country, about half of us are employed by small businesses, mostly with fewer than 50 employees. And so many of those protections, unless the business decides that they want to provide those protections, they may not be required necessarily to provide those protections, including health insurance coverage. And as we talked about, we have a lot of working age population who are doing independent or freelance work. What we would call precarious contracts with a lot of job insecurity, like we discussed in the gig economy. We've done qualitative research partnering with our colleagues at Kaiser and here at the University of Colorado at the Colorado Cancer Center, looking at themes when we've talked to employers. So earlier this year, we convened a group of employers, and these are the kinds of topics that came up from the employer perspective around, what do we need to be thinking about? And these were, just to give you a few of the headlines, they recognize that culture, the level of concern in the workplace, the benefits were all important. They also recognize the importance of leadership. We really, as managers, as supervisors, as company leaders, set the tone around whether we're going to have a total worker health culture or not. There was discussion about individual and organizational productivity, the costs, both direct and indirect, to the business, effects on workplace morale, the challenges for just keeping the business running if a key employee has to be out for cancer treatment. It might even be the CEO of the company who has cancer, and what's the impact on the survival of a small business. And recognizing the need for education, training, and more resources. So these were the messages that we got back in talking with employers around the state of Colorado, and it's reflected by what I'm learning nationally as I talk to more employers.
Were these employers kind of a mix of all size businesses, 50 and less, or less, 50 and more? Yeah,
they were ranged from small businesses to larger corporations. When we asked them to rank what they thought was their role in supporting cancer survivors and what they thought were the responsibilities and the priorities and some of their ideas around what they knew to be actionable items. Their first priority focused on accommodations, and the things that they talked about were things like offering telework where possible, offering access to technology, just having a laptop to work from home for people who have that kind of job, an office job, offering gradual work return and light duty, flexible scheduling. On the education front, there was a lot of discussion around proactively educating employees about their benefits, the regulations, the privacy policies, not waiting for someone to develop cancer, but having there be just better education of the managers and the rest of the workforce around what are our policies and benefits. Having in place the benefits that we've talked about, and fourth on this list was knowing how to direct employees to resources, having open communication, cultivating creating a culture that was non-punitive, that's compassionate, that's solution-oriented for the worker. These were the kinds of things that we heard about from employers that we had focus groups with. You can put an ROI, return on investment, spin on this if you'd like, but a lot of what we've heard has also been around the value of the investment in creating a cancer patient supportive workplace. And I'm not going to spend a lot of time on this right now, but you all are going to have access to the slides. I'm just going to make a couple of key points. First one is that if you had to make a case around return on investment, employee retention is a big deal, right? So doing things that anytime you lose an employee, you have a cost of replacing that employee. You have the training costs. You have the time it takes for them to become productive. You have the impact on culture. There are lots of ways in which businesses suffer when they don't have employee retention. So that's probably the biggest case around return on investment. They're doing some construction on the floor above us, so if you're hearing that noise, no one's doing dental work. It's someone drilling. But on this point, there's a lot that you can read about the impact of employee turnover and what it costs employers. There's the cost to value curve of an employee. I'm not going to spend time on it today, but you can put it all in this context. But if you really need a business case for why you should be working on this as employers to create cancer patient supportive workplaces, usually the things that these employees need to help retain them are not all that expensive in the bigger picture against losing a valued employee, and the listed here are some of the kinds of things that we've talked about that they might need to be able to stay on the job. So the leave part, time to recuperate, periodic breaks, even while they're on the job, sometimes a private place to take medications, modify work schedules, permission to work at home if possible. Sometimes it's modifying the temperature in the office or reassignment if they can't perform their assigned job. So these are some of the support services to be considering. There is a link between making those accommodations and outcomes. So in a study that Newmark did in patients with breast cancer, having flexible schedules, reducing work hours where possible, giving laptops to work from home, those kinds of accommodations were statistically significantly associated with job retention and improved health status in those workers. That's a big deal.
That's big,
yeah. But so there's more to meeting survivors' needs. We have to wrap our heads around survivor empathy, understanding, and honesty. And those are words that come up time and again when you talk to cancer survivors in the workplace. If there is a perception that my supervisor has these qualities, this empathy, understanding, and honesty, then there's less of a sense of pressure, and we can work to solutions. So it's creating a supportive culture. Culture in the context of a cancer survivor means addressing the pressures in the workplace, having a culture that reduces stigma, that the culture of acceptance, having a supportive environment on that positive side. So I was really glad that you brought that up right at the front, because this is so much at the core of what we hear from employees. There is more that our healthcare providers could be doing to help cancer survivors succeed at work. And I'm just going to do a shout out, if anybody is on this call who works in healthcare and works with cancer survivors from the medical side, there's a whole lot more that we could be doing to serve as the navigators, the brokers between the patient and the employer. And I'm not going to put a lot of time into it today, but you'll have a few slides to share. Sorry for the noise in the background here. It's just the construction that we're doing in the building.
Gosh.
Oh, they want to download your new font.
Yeah, that's very strange. Apologize about that. Let's see.
Okay. We're challenged here.
Yeah.
But there's there is a role for the care team and other providers to serve as these brokers. But where I want to get to is to share with you that there are some great resources out there that are great for the cancer survivor to have access to, and specifically for managers, coworkers, anyone in the workplace, as well as for healthcare professionals. And they call it the Guide to Help Patients Manage Work and Cancer, but it's not just for the healthcare professionals. This has it's
a great resource.
It is a fabulous resource. So
I would flag too. I know they have a meeting or conference, what they call it, in October, and they have scholarships available to people who want to fill out their application and attend. It's in LA, so I would definitely check out their website and see if that's of interest to you.
Yeah, no, that's great. I didn't realize that they had the conference too, but I send everybody to this particular resource. And they have in there, and I'm not going to take a lot of time on it today because we're almost out of time, but they have road mapping questions that really individual patients, the workers, should be asking, that tie into questions that they may need to get answers from their employer around, and that as healthcare providers working, if you're the oncologist or you're part of the care team, talking through with a cancer survivor who wants to return to work, just understanding how their treatment is going to affect their work and their schedule, and what are the job demands, what kinds of barriers are there going to be physically getting to work, like we were talking about earlier. How many hours realistically can somebody put in to work now or when they return, or if they have a recurrence of cancer? What are going to be the other impacts on their life and their daily activities? So they have in there a great list of these questions and discussion points around them, and they have more that include things like what are the pros and cons of delaying your return to work financially, emotionally? How is your personal identity tied to your work? What parts of your job might be more difficult to do during or after treatment? Just confronting that and tying that to understanding whether you've got a flexible work environment and one that can be accommodating. So I refer you to that site. They also have checklists for facilitating the conversation regarding work. And here's more of these issues, even around privacy and whether you share the diagnosis at work, whether you put the information on your Facebook page where other people might see it, who you work with, who you otherwise weren't thinking that you wanted to share it with. So there's a lot that's been thought through in that regard. So I want to come back to this slide. We as individuals, even when we develop cancer, want to be productive. We need leadership that understands that our productivity is at least temporarily and maybe permanently impacted by the development of cancer. For people to understand the important engagement between my productivity and my organization's culture, my health and work conditions are all interlinked for meeting the mission. And so that this fits into this schema. Here are a few things I want to leave you with as some things that you can do now proactively if you're an employer. Return to work training, establishing company best practices for communication that we use with anybody who's on leave for any cause. having written return to work policies or guidelines, discussing cancer and how cancer affects employees, including the secondary trauma training, which is what they call it. So how does knowing or having a cancer survivor in the workplace affect the rest of your team? It's something that doesn't get as much attention, but I can tell you in our company, I mean, it had an impact even when we had a coworker whose sister developed cancer.
Wow.
That had an impact on our whole team. So these are the kinds of things that people can be doing now. You don't have to wait for somebody in the workplace to develop cancer to be addressing. Knowing what the legal policies are and how to avoid discrimination, like that EEOIC website, and leadership training that promotes an overall culture of health and well-being, which leads into my promo slide, which is for those of you who have not been involved with us yet, there's an opportunity to get free training on how to improve organizational culture, of which cancer survivorship in the workplace is just a part. But you may want to contact Jenna Lavallee, who is on the team for our CDC funded project called Swell. If your organization qualifies to be in Swell, there's free leadership training and a lot of other things that come with that just by participating in this national study. And very much of that is built around organizational culture and leadership. So please contact Jenna if you want to find out if you qualify to be part of the study that the CDC is funding for us to do. Here are some of the resources that I mentioned and a few others that you might find interesting. You can come back to these slides anytime. And with that, I just want to say thank you from our team here at the Center for Health, Work, and Environment. Thank you for bearing with us through the drilling that's going on in our very active workplace. I'm happy to say that we're going to get a little bit more space out of the deal. And with that, please stay connected with us.
Yes, thank you so much. And I'll wrap it up fairly quickly. I do want to check if there was any questions in our chat box. And now's the time to go ahead and continue to write those in. Thank you again for bearing with us through not only the noise, but the having it in presenter view for most of the time there, and just sticking with us, because this is a really important topic, and I'm so happy to get more and more out there information related to this, and we'd love to get your feedback. So when you receive the survey today, please feel free to rate that and send any comments that you have directly to me. These are our upcoming events. So we have the Rocky Mountain Safety Conference is next week, and our next webinar is going to be October 17th, and it's around office ergonomics. So definitely sign up for both of those, and you can also join our HealthLinks listserv, and you'll get all of the updates on trainings and events and exciting HealthLinks updates.
Hey, Kaylee, I just want to, I'm going to interrupt you and just say thank you for being here with me today and for being in this conversation with me. And I just want to say a shout out and thank you to the people who are on the line. Definitely.
All right, well, enjoy the rest of your Wednesday, and we will see you guys next time. Thanks.
Bye-bye.